A very good morning to the MIDEC committee and the fellow contestant. My name is Chong Pin Xuan. I'm from Surgery Faculty of Dentistry, Guatemala. Today, my group and I are going to present about our research topic entitled Evaluation of Antimicrobial Effects of Cinnamon zeylanicum extract on Staphylococcus aureus. These are our content. Oral health is an integral part of general health. Oral diseases may be considered as a major public health problem. The most common type of chronic diseases that affect mankind are dental caries, periodontal diseases, candidiasis, and some of the end-of-the-day lesion. These oral diseases tend to affect our daily life and may lead to severe complications if being neglected. The most common type of bacteria associated with this lesion are Streptococcus mutans, Lactobacilli, Streptococcus salivarius, and etc. However, organism called Staphylococcus aureus is also a presumed pathogen for many types of oral diseases such as oral mucositis, periodontitis, peri-implantitis, endodontic infection, and even some of the dental caries. S. aureus is a gram-positive, non-spore-forming, non-motile grape-like cluster. Some of the S. aureus strains have developed drug resistance. Methicillin-resistant Staphylococcus aureus are the strains of S. aureus that have been resistant to beta-lactam antibiotic, which include penicillin, amoxicillin, and etc. Many bacterial diseases occur in hospital and community due to their strain sometimes may lead to death. Therefore, preventing and controlling these diseases has been a great challenge. For many ages, many prophylactic agents have been used to prevent them, such as antibiotic, mouthwashes, toothpaste, gel, varnishes, and even caries vaccine. Although they have proved to be effective, chemical products may have some clinical disadvantage, like it will cause teeth discoloration, taste alteration, mouth dryness, oral mucosa lesion, nausea, vomiting, headache, and also increase in drug resistance exhibited by the pathogen. Therefore, this creates the need of searching alternative prevention and also treatment options that are safer, effective, and also economical. Hence, herbs and spices they were considered as a good alternative and may start to employing to treat various types of diseases. Cinnamon, also known as cinnamon zeylanicum, is one among the spices which belong to the family Lauriceae. It's widely applied in dishes, pickles, and soup. Cinnamon aldehyde, cinnamon acetate, and also cinnamon alcohol are the three main components of cinnamon. Due to its antimicrobial activity, it is used as a health-promoting agent to treat various diseases like inflammation, gastrointestinal disorder, and also urinary infection. Cinnamon is also used in cosmetic or food products. However, very few studies have evaluated its antimicrobial activity against Staphylococcus aureus. Our aim and objective is to evaluate the antimicrobial effects of cinnamon zeylanicum extract on the Staphylococcus aureus strain. These are our methodology. So 10 different blood samples were collected. Ethical clearance and patient consent forms was obtained from the research. Commercially available cinnamon zeylanicum was diluted using ethanol to 3 different types of concentration of 35%, 50%, and 100%. The samples were cultured in neutral blood agar and then is transferred into selective agar, that is muller-Hilton agar, in order to culture the S. aureus. The antimicrobial activity of extract were determined using agar disc diffusion method. The filter paper disc of 6 mm in diameter containing different concentrations were placed on the incubated plate, following by incubation at 37 degrees for 24 hours. Fluoxetine was used as a control group. The zone of inhibition was measured in millimeters and data were subjected for statistical analysis. This is our result analysis. The results show the statistically significant difference in the zone of inhibition between the different extracts, with a mean rank of 29.05 for chlorhexidine, 12.95 for 25% cinnamon, 20 for 50% cinnamon, and also 20 for 100% cinnamon, with a p-value of 0.011. This is our result analysis tabulated in the bar chart form. For the discussion part, cinnamon is a tropical evergreen tree grown in Southeast Asia, used for the preparation of different types of chocolate, beverages, and spice candy. In addition, cinnamon has been employed to treat a variety of health conditions. It has been also used as an antimicrobial, anti-inflammatory, antioxidant, anti-mutagenic, and also as neuroprotective. Almost every part of the cinnamon tree has some medicinal uses. The present study evaluated the antimicrobial properties of cinnamon against S. aureus with a chlorhexidine as a control group. It is considered as a golden standard drug as a preventive measure for its known of antimicrobial activity. The antimicrobial activity of cinnamon may be attributed to the presence of phytoingredients. This is in accordance with the work who reported that the antimicrobial activity of cinnamon zeylanicum bark is mainly due to the presence of phytochemicals such as cinnamon aldehyde, ethyl cinnamate, tetrahydrophenylene, and eugenol. However, the screening for phytochemicals was not as a part in our current study, but several studies has demonstrated the presence of active antimicrobial components in the cinnamon extract. Similar to our present study, the study has confirmed the medicinal potential of cinnamon, which was found to be possessed reasonably high antimicrobial activity on the E. coli, S. aureus, and P. aegiriosa. Many researchers have demonstrated the effective antimicrobial properties of the essential oil of cinnamon, and it has been implicated in the antimicrobial effects towards gram-positive or negative bacteria, and even some of the fungal species, through the inhibition of bacterial enzyme or causing the intense damage to the bacterial cell wall. The present study indicated that the antimicrobial activity of cinnamon against S. aureus. The result of our study was similar with the previous finding of different researchers who reported that the cinnamon inhibited the growth of Staphylococcus aureus and also Candida albicans. Other studies has also reported the antimicrobial effect of cinnamon oil against S. aureus strain. In conclusion, cinnamon zeylanicum extract may be effective against Staphylococcus aureus as it shows better inhibition zone at a concentration above 50%. Despite the result highlighting the potential of cinnamon as an antimicrobial agent, the sample size of this study was insufficient to reveal the actual effect of it on the organism. Therefore, more long-term clinical studies are recommended to evaluate the antimicrobial properties of it. These are our references. By this golden opportunity, I would like to thank Segi Faculty of Dentistry, our Dean Dr. Ahmad, our mentor and research supervisor, Associate Prof. Anand, Dr. Daniel, co-researcher and the MIDEC committee, and all attendees. And this is the end of our research and the presentation. Thank you for listening.